All right, welcome to another episode of Around the County. I'm Miles Himmel, Communications Director for District 5, and we have San Diego County Supervisor Jim Desmond with us as well. We got a special guest here today, Eran Bendavid, Associate Professor of Medicine and Senior Fellow at the Woods Institute for the Environment. And Eran, we kind of just want to start with this question. Who are you? Let the people know who you are.
So just briefly, thank you for having me. I'm delighted to share some of our work. So I'm a medical doctor. I'm a physician by vocational training, and my specialty is in infectious diseases. And I have been on the faculty and associate professor at Stanford for the past, a little over 10 years. I practice infectious diseases in the hospital every once in a while. Most of my work has been on health policy evaluation and assessment of what to do about various infections, including HIV, and obviously over the past year, quite a bit of work about COVID.
Yeah, the reason I found you, and I know you've been working on this for months, or like you said, since the beginning of this, is a recent study about the lockdowns, and that's kind of what I was curious about. Do you mind sharing how you went about it and then what you learned?
So, the study I think that you're referring to is a study where we did an empirical assessment of what we can say and what we can see about the effects of various measures to try to curb or flatten the curve and curb the spread of cases and infections, and how that actually went. And the reason we wanted to do that is I think probably something that and you probably share in some ways, that we see, in some places it seems like they impose strict lockdowns and they have cases going up, and other places they seem to be, things seem to be a little bit more mild in terms of the government restrictions, and they seem to be doing okay with their cases. And so it's sort of all over the map. And so we wanted to try to get some kind of a systematic picture of what we can tell. The other reason that we wanted to go about doing this is that to date in the scientific literature, there has been several studies that have been quite influential that suggested that, look, these lockdowns have been really remarkably effective, and there's in June there were a pair of articles in Nature, one using a model and one using sort of empirical data that said, look, these lockdowns have been really remarkable at flattening the curve and reducing the spread of infections and cases. And there was something about that just didn't quite sit right from just the way that we observe the world. And so we wanted to get a closer look at that. And so that was the motivation for doing this study.
So what were your outcomes?
Let me just talk a little bit about how we went about this. I mean, obviously, assessing what we've been doing and getting a close look at the effects of our policies on this disease is critical, right? I mean, we've all been living with this now for almost a year, and we know many of the consequences of the policies. A lot of unemployment, a lot of we hear more and more about the isolation and mental health consequences, and all of these have been so we know that there have been some serious consequences to our policies, and in some place we assume that this was warranted in some ways to stop the spread of this disease. But if these policies are not really effective at stopping the spread of disease, and that's something for us to sort of think about very carefully. Now, here's what we did is we looked at countries that imposed very severe, very strict restrictions. Okay, so we call those the countries that impose more restrictive measures or interventions, and those include the United States and include the UK and Spain and Germany and Italy, and then what we did is we looked at a couple of countries that didn't, and we looked at Sweden and we looked at South Korea, that really relied much more on testing and quarantining, test and isolation kind of strategies, but they didn't lock anyone. There was no mandatory measures from the government. And so what we did is we looked at what happens to cases subsequent to imposition of various measures. Okay, so you put in something like travel ban, and what happens to the curve of cases after that gets imposed. And we looked at it sort of part by part for every country. And so we have a lot of these sort of almost like moving pieces where we looked at, a measure is imposed and what happens to the cases. And by comparing places that did have very restrictive measures to places that don't, we can sort of isolate what happens to what's the effect of these very restrictive measures. And what we see is that the curve is bent. Having the government, or having the sort of around March and April, having the measures put in place, the curve is bent, but it's bent about to the same extent in the places that imposed various that didn't. And so it is when you're trying to look at that, was there an additional benefit of the severe measures? And the ones that we sort of isolate and we focus on are two in particular: the mandatory stay-at-home and mandatory business closures. Was there an additional benefit of these two? And we can't, we just don't see it in the data. So for these 10 countries that where we looked at, and these are the 10 countries that you'd think of as the very hard hit countries in the US and in Europe and Iran as well. For those 10 countries that they imposing these additional measures, on top of things that are a little bit more voluntary or suggestive, and travel bans, and some of the more sort of you might call them maybe sustainable measures, because they're not as restrictive. Having those strict measures didn't seem to to give us any additional benefit in terms of bending the curve of cases. And so that's that's the primary thing. Now it's science and it's numbers and it's data, and so there's uncertainty, and we can't entirely rule out some small benefit. But overall, it doesn't suggest to have given us much.
Well, so are you saying that the countries that locked down or had business closures and things like that, the case rates were pretty much similar to those like South Korea, and I think you said it was Sweden,
yeah,
that did not impose those? Did South Korea and Sweden have similar number of cases, or about the same as those that locked down? I'm just kind of,
the reason why we picked the countries we did is we looked at countries where there was substantial or substantive spread of the disease, right? And so we didn't look at the countries that pretty much managed to keep it offshore, like New Zealand and Taiwan, and countries that managed to sort of have enough, isolate their country enough early on that there was never really any substantial spread. And so the Sweden and Korea, in terms of number of cases, yes, things were picking up quite early, and quite substantially, in a way that the spread was, you could see the same kind of spread prior to any measures, the same kind of what we call the reproductive rate, and then what we see is that once yeah, I mean, here's a little bit of my basic understanding of what happened is that you have a lot of news coming on, and you see what's happening in Italy, and people all over the world see that, and you have governments sort of obviously getting concerned and starting to convey information to their citizenry, and people change their behaviors as a response to that, in response to that. And you see that there's a lot of change in behavior prior to the actual lockdowns, and that's not our study. That's been shown, in many places, sort of again and again. You can sort of see the mobility data. People stop driving to work and stop going out of their home as much, even without the mandatory measures. And so you see those changes in behavior. Those are the ones that are going to be responsible for the reduction, for the flattening of the curve of cases. And those had those had no relationship to the actual mandatory measures. And so we see those flattening of the curve basically, it looks about the same in Sweden and in South Korea that didn't impose strict measures as.
Was there? Did it take longer for the ramp up to happen for the countries that did go into lockdown, or were they pretty much in the same trajectory at the same times? I'm just wondering if the ones that didn't do lockdowns, they went up sooner, and maybe the ones who did do lockdowns went up later. I don't know. Was that, or it didn't matter?
Yeah, no, so that, that one didn't really matter all that much. What we're looking at is we're giving them about the same kind of benefit of saying, well, the countries and governments decide when to impose the various measures in response to what's happening in their country. And so, when a country decides that, okay, now it's time to, to do a travel ban, now it's time to close schools, now it's time to do that, presumably these are in some way responsive to what's happening, what they're seeing on the ground. And so, so all the countries in some ways sort of impose those, more or less, everything happened very fast back in the spring, right? And so everything happened sometime between, maybe early March to late March. Most places sort of did, that's when they sort of chose to impose their various interventions and public health measures. And so there was no big difference in terms of when the measures were imposed in relationship to how far spread the epidemic was. Now here, I think part of what you're raising is an important point, is that this is a very, very rapidly spreading virus, and in some ways it's kind of sneaky with all of the asymptomatic transmission, and it's very hard to control it with the kinds of stuff that we think that would be effective. And I think what happened is that there was probably the actual spread of the disease was not entirely known, and by the time that we sort of managed or became fully aware of what's going on, it was already far widespread, much more widespread than we could do with controlling it with this kind of measures that we did. And so, in some ways, like we tried to do what we could, but there was no way of really containing it. And so what we're seeing is the kind of the ongoing spread, despite the fact that people did what they could, and the governments imposed their various interventions.
So apparently, I guess I'm a layman, I'm not a doctor, but just the virus doesn't care if your businesses are closed or not. I mean, it really doesn't. It's going to do what it's going to do, regardless of if you were open or closed or whatever.
I mean, the virus spreads very, very rapidly, right, among different groups and people. And, the spread of the virus, except for children, is actually pretty even. Obviously, we know that older people are very much more likely to have a severe disease and much more likely to end up in the ICU and die. That we know. But in terms of who gets the virus, it seems to sort of spread about evenly, except for young children. And there's again, there's some uncertainty, but there's clearly not like a particular age group that seems to get it worse than others. And it seems to have a component of transmission that's about just aerosols, and obviously about being in close quarters and without, in places where people are all close together and indoors and poor ventilation. And that's, I think what happened, my suspicion is that we sort of, in some ways, we didn't stop frontline workers and essential workers from going to work. And so they continue to sort of move around and deliver food and go work at grocery stores, and then come home. And oftentimes, again, because those are sort of lower income, they come from lower income kind of communities, and so they have more people at home and more crowded homes, less well ventilated, and so that's why we see a lot of the concentration of cases and infections in those communities.
Well, so do you think then? So there really isn't a better way to do it. Either there's no advantage to lockdowns or no lockdowns. That's about the same. But then, I've always been advocating, we can, fight the virus and we can be safe. And to me, as I go out and talk to different businesses that, some that are shut down and some that are not, the ones that are shut down are feeling, discriminated against because they, there's no proof that their business or outdoor dining or getting your hair cut or bar, salons, there was no proof of them, spreading it, but they were just chosen to be shut down because they were trying to stop people from gathering. And
Right.
unfortunately, I think it pushed people to gathering in places that were less safe at home.
Yeah, right. I mean, I think that, these are also very, very reasonable and serious considerations. I think what, we have learned quite a bit about where, how the virus is transmitted and where it happens and the kind of settings where transmission is more likely to happen. And, I, in my mind, I wish we had done more I can understand back in March, we didn't know much about the virus and it was going so fast and we were getting, New York and New Jersey, the hospitals were overwhelmed and it was clear that we needed to act fast. Okay, that, there's a lot of I can understand that, but we've learned a lot about the virus since. We've learned about which groups are more affected than others, which groups, which groups need the most protection, where transmission happens, where transmission is more likely and less likely to happen. We know that outdoor is very unlikely. We know that well-ventilated places are much less likely than poorly ventilated indoor places where people are without masks. And so we could have done a better job at being a little bit more nuanced and a little bit more responsive to the things that we have learned. And and I think in particular, I think protecting and diverting resources to protecting the elderly rather than having more blunt measures. We could have both done a lot in terms of protecting our most vulnerable communities and potentially causing less of the unintended consequences on those who are less affected.
One of the big pushes here lately in San Diego County is for youth sports, high school teams and things like that, we're hearing from the coaches, we're hearing from the parents and the children, and they're saying, they're playing professional sports on TV, and I can see the argument of, well, if they catch it playing sports, they might bring it home. Do you have any opinion on either youth sports or opening up businesses or restaurants or what's, as a doctor, what are your thoughts?
Yeah, I mean, I'm not gonna have any very specific policy prescriptions because I think in the end, the policy prescriptions in some ways that's your tough job, and it's and in some ways it's a mix of some of the stuff that obviously comes from science and from epidemiology as well as and balance a lot of things. No, I think that's right. I can tell you, probably the risk of transmission if kids are playing soccer outdoors, very low, very low risk. And the risk of kids having a severe case, very, very, very low risk. Now, can they bring it home? Yes, but I think this is where in some ways, we sort of, we haven't grappled with how to protect elderly and instead we just said, well, there's always going to be this risk, and of course there's always a risk, but we can reduce that risk and try to balance things, by focusing resources on how to protecting elderly, getting more testing in long-term care facility, nursing homes, these kinds of environment where really the epidemic has exacted the highest toll.
Oh, okay. Miles, do you have any?
Well, yeah, I just wanted to kind of add it up. I mean, you guys kind of have answered, what we were talking about, but I mean, we're in California, we're in San Diego County, but California is the state, and I think the most restrictive state now. If you were in the governor's ear, or if you were the one making decisions, what would you say? Because I mean, on the one hand, like you guys are talking about, cases are high, but on the other hand, there's businesses that haven't been open for 8 months.
Yeah, I mean, this is why this is why I'm not in politics, and these are very very tough decisions. Yeah, right. I mean, people are afraid and people are concerned, and all of these are difficult considerations to sort of bring it all together. I have sympathy for both for the governor and the kind of decisions he has to make, as well as for the businesses, and that you're right, and not only businesses, but a lot of people are kind of, they're like, well, you shut us down in March or April, and then again in the summer, and now again, and and every time that it happens, it seems to sort of the goalposts seem to sort of move a little bit, and it's really tiring. And you give us some support, and we're trying to do our best to keep things open, but boy, man, it's getting to be a long time. So all of these are also very very difficult considerations. From I think from the epidemiology again, I think we can do a better job at tailoring, protecting those who need the most protection, and focusing our resources there, and having things that are a little bit more sustainable for everybody else. I think the fact that this is exacting a heavy toll on business owners and on school kids and on parents, that shouldn't be ignored.
Yeah. Well, thank you so much. I was hanging on every word. I really appreciate your insights and the study that you did, and what you came up with, and sharing that with us, and by staying out of politics. You're very smart, man.
Well, I appreciate it, and I'll be happy to talk to you, and whatever I can do. If there's more, I can. If you guys want to have a Q&A with the rest of the supervisors, I'd be happy to do that.
Oh, perfect. Okay.
Okay.
Thanks.
Thanks,
Doc.